Good afternoon, and welcome to this Hogue Community Talk Health Series. My name is Dr. Wayne Gui, and I'm an ophthalmologist and retina specialist. And today I want to talk to you about the aging eye, what is normal and what is not. Thank you very much for joining me. And just a little bit about myself. Next slide. I have no financial disclosures. Next slide. So, as I said, I'm an ophthalmologist, board certified. I am also a vitreoretinal specialist and surgeon. I was educated for college at Cornell University and medical school at Yale. I had my ophthalmology and retina training at UCLA. I'm currently in private practice, specializing in medical and surgical retina. And I'm also a volunteer clinical instructor of ophthalmology at the Stein Eye Institute at UCLA. And I have offices in Huntington Beach and Laguna Hills. And before I begin, I just wanted to let you know that if you have questions, I'm very happy to answer them, but I'll answer them at the end of the presentation, just so that we can get through all of the slides. But feel free to type in your questions at any time. So let's talk a little bit about the topics we'll be discussing today. First, how does the eye work? A brief history of ophthalmology. Normal aging changes of the eye, in contrast to eye disease in aging. And then practical advice, prevention, screening, and emergencies. And then at the end, a Q&A. So how does the eye work? Well, it goes many centuries in terms of the human fascination with the eyes and eyesight. And interestingly, not only is it for the general public, but even within medicine, we don't really have, the general physician doesn't really dedicate that much time to ophthalmology. So, and yet it's such an important sense, perhaps one of the most important senses for all of us. And so, it is something that may present as an enigma, but I want to make it a little bit more accessible and to help you, understand how everything works with the eyes. Of course, we'll do that with a very short time frame, so let's continue. The human eye is a specialized sense organ capable of receiving visual images, which are then carried to the brain. Now, going back, as I said, centuries and even millennia, to ancient Egypt and to the Greeks, to ancient India, and other cultures, it has really been a source of fascination and wonder. Now let's talk a little bit about the auxiliary structures. So, as you know, all parts of the eye and the surrounding structures are important in how everything works. So, in addition to the eyeball itself, there is the orbit, which is the bony structure right around the eye. There are the eyelids, which help, the main function is to keep the eye lubricated. The lacrimal glands, which are the tear glands that are important in tear production, and then the eye muscles or extraocular muscles. These help us look in various directions. So here's a picture of the bony orbit of the left eye, which is the area kind of surrounding the eyeball, and then also some of the extraocular muscles with the left eye here. Here's a diagram of the lacrimal gland up top, highlighted in purple, along with some various structures of the front part of the eye and the surrounding structures. So you have the cornea, and on the superficial layer of the cornea lies the tear film, which is composed of a mucus layer, a watery layer, and oily layer. There are also meibomian glands, which help produce some of the oil. Now, continuing forth, we have transparent media. And this includes the aqueous humor, the crystalline lens, and the vitreous body. Now, it's important for the media to be transparent because we want to be able to see the light that actually enters into the eye. And so here's a diagram in cross-section of the eye showing the production of fluid. And so it's produced by these structures down there called the ciliary body, which is right behind the iris. And if you follow the yellow arrows, that is the path of the aqueous humor that's produced, and it drains into the angle of the eye. Next, here's another picture of the eye showing some additional structures in addition to the cornea, which is in the front, the iris, which is the colored part of the eye, the pupil, which is the opening in the iris that allows the light in, the crystalline lens right behind that. You have the vitreous, which is the main body of the eye, mostly composed of water, but also having important macromolecules and proteins. Then behind that, you have the retina, and a special part of the retina is called the macula, and that is responsible for most of the important parts of your vision. So for reading and for distance acuity, the macula is where the light focuses and where you are able to see for fine activities. And then the fibers of the retina coalesce into a structure called the optic nerve, which is transmitted to your brain to allow you to process the images. So now we talked a little bit about the eyeball already, but there are three kind of main coats or main parts of the eyeball. The sclera, which is the white outermost coat, and that's responsible for the integrity of the eye. And then the middle coat is called the uvea, and that has a lot of important blood vessels and exchange of nutrients. And then the retina and the retinal pigment epithelium. And basically that is, if you think of your eye as an old camera, the analogy is like the film of the camera. So it takes the light and it converts that into electrical signals for your brain to interpret as images. And so here is another schematic of the eye, and as you can see, the sclera is kind of the it maintains the structural integrity of the eye. Then you have the retina, which is the innermost part, and in between is the uvea. Now, at the back of the eye is where the retina sits, and it, as I mentioned earlier, it transmits electrical signals to your brain to interpret. And so within the retina, there are various layers, and we won't go into all the different layers, but some of the key structures are the cone and rod cells, and you may have heard of this. And so these are the cells that take in the light and basically allow the signal to be transmitted to the brain. And so the cones are mostly responsible for color vision, and rods mostly for lower light vision and peripheral vision. So I won't go into everything here, and it's somewhat of a busy slide, but my point in putting this in the presentation is to further highlight how much humans and have been thinking about ophthalmology and wondered about the eye for centuries and millennia. So going back to ancient Babylon over 4,000 years ago, all the way to the modern day. Now, some of the more recent important advances in ophthalmology are towards the right of the slide. 1851, Helmholtz invented the direct ophthalmoscope, and in 1967, Kelman was responsible for what is essentially the technique for modern cataract surgery. So now let's get into the bulk of the presentation. So, as you know, the title and the topic that we're discussing today is the aging eye. So let's first start with normal aging changes. As we learn in medical school, you can't really learn about diseases until you know what the normal state is. So you have to learn physiology before pathology. So one of the most common changes that happens with aging is having trouble reading fine print. Now, this is mostly due to weakening of something called accommodation, where the lens, the crystalline lens, isn't able to form sort of its normal configuration in the accommodated state when you're reading. And so what happens is then something develops that's known as presbyopia or farsightedness. Typically, reading glasses are the first line of treatment. Contacts and surgery may be considered, but as you might have heard, last year in October, the FDA approved a new medication that can be used as an alternative. But this is a very normal aging change. Next, dry eyes. So, here in Southern California, dry eyes is a big problem, and even as a retina specialist, where I focus on the back part of the eye, a lot of my patients tell me that they have dry eyes, and it is quite bothersome. So, why does it happen? Well, tear production is very important to help keep your eyes lubricated, and for your eyes to function properly, the eyes need to be lubricated. But as we all age, what happens is the tear production decreases, and this is especially common in women, especially postmenopausal women. And so what happens is then the dryness kind of triggers a reflex, and paradoxically, you might have increased tearing. But in fact, the source of that often is from dryness of the eyes. So what can you do? Well, some of the common treatments include artificial tears, lubricating ointments, blocking the drainage system, the tear ducts, to help keep the tears in place a little bit better, and then prescription eye drops as well. Another normal aging change as we age is difficulty seeing at night. Now, older adults may notice that eyes take a little bit longer to adjust and focus in the dark than they used to. So what happens is the rods that are responsible for your vision in low light typically weaken as we age. And actually, the National Traffic Safety Administration recommends that older people limit driving to daylight hours only. Another normal aging change is that objects might seem to blend into the background. Now, why would that be? Well, it might be difficult to distinguish objects from different colors, such as milk in a white cup. And this is something called loss of contrast sensitivity. And so what happens is usually we're able to sort of resolve letters and images even when the contrast isn't at its optimal level. But as we age, we kind of lose this ability. And so some of the ways that one might address this is through low vision techniques, such as improving lighting, reducing glare by covering the shiny surfaces and wearing sunglasses, increasing contrast by using a colored tablecloth for white dishes, among other techniques. Now, another common aging change is red or swollen eyelids, and often this is caused by something called blepharitis, which is inflammation of the eyelids. I won't go into a very in high detail because sometimes it is associated with an organism that kind of lives on your eyelids, and that gets into that kind of opens up another can of worms. But just know that this is quite common, and treatments include warm compresses, eyelid scrubs, antibiotics, eye drops, and then skin and eyelid hygiene. Another normal aging change, and we've already sort of touched a little bit upon it, is cataracts. So what is a cataract? And you probably have heard this among your friends and family. So a cataract is simply a clouding of your lens. So when we're born and when we're young, our lens is very clear and allows the light to focus exactly on the retina unimpeded. But what happens as we age is these proteins sort of rearrange, and it makes the lens cloudier, and so the vision becomes more blurry, increasing glare and needing more light to read. The only proven treatment right now is surgery. And so, you might hear about all these other treatments and techniques, but nothing has been proven except for cataract surgery. Okay, so now that we've covered some of the more common sort of normal aging changes, let's talk about eye disease. So one of the most common eye diseases in aging is something called macular degeneration, AMD, and it's age-related. So it's age-related macular degeneration. Now, if you recall, the macula is the central part of the retina that is responsible for reading and fine acuity. And so this is a common eye disease that actually is usually found in adults over the age of 50. It typically affects only the central vision, and patients often complain of distortions and blind spots. Treatment really depends on what form of macular degeneration, and these treatments may include vitamins or even injections into the eye. Another eye disease that is seen more in aging is retinal detachment. Now, you probably have heard of a retinal detachment, and it is considered a surgical emergency. It's usually accompanied by flashing lights, floaters, or curtains. And what happens is there's usually a change in the status of the vitreous, such that the vitreous, this gel in the eye, sort of causes a tear in the retina. And then the fluid within the eye gets under the retina and causes the retina to detach. It's very important for patients to be evaluated by an ophthalmologist and ultimately a retina specialist to be treated, because this can be completely blinding if it's not treated in time. The next disease that's more common in aging is glaucoma. So, to get into the precise definitions and sort of the nitty-gritty of glaucoma is beyond the scope of this talk, but typically glaucoma is marked by damage to the optic nerve that is often associated with higher pressures, but not always. And so, in some ways, it's almost like a black box type of diagnosis. Nevertheless, it's important to pick up on it and to have it diagnosed, because what can happen is the vision in the periphery typically is lost first, and then symptoms might not actually be noticed until very late in the disease. So it's important for patients to be evaluated by ophthalmologists to diagnose and treat glaucoma. Now, the next disease is diabetic retinopathy. And so for anyone who's living with diabetes, or you have friends or family with diabetes, it is one of the most common ways to lose your vision. Now, how does this work? Well, adults who have diabetes may suffer the consequences of poor control of their sugar. What happens is the blood vessels aren't normal, the retina is not getting the proper nourishment, and so all sorts of detrimental events can happen, which can lead to permanent blindness if it's not diagnosed, first of all, and if it's not treated. So at a bare minimum, even if there are no symptoms, anyone who is a diabetic should have an annual screening by an ophthalmologist or retina specialist. And treatment, first and foremost, is control of the blood sugar, but beyond that, a combination of systemic and local therapy. Another disease in aging for the eye is something called a retinal vein occlusion or retinal arterial occlusion, and these are often known as a stroke in the eye. Now, many of you might not have heard of this or know that this can happen, but typically if we think about the veins versus the arteries, the vein occlusions are usually associated with high blood pressure or other abnormalities in the blood vessels. The artery occlusions are usually associated with clots that emerge from the carotid arteries in the neck or from the heart. So just to back up a little bit and talk about the artery and the veins. So arteries in our body they leave the heart, and they provide oxygen and other nutrients to the tissue. In this case, it would be the retina. And then the veins deliver the waste products and carbon dioxide back to the heart to be recycled. And so this diagnosis, either the retinal artery occlusion or retinal vein occlusion, can be quite devastating. And so it's very important that if you have something like this, that you're referred to a retinal specialist for treatment. Another eye disease that can be found with aging is something called ocular melanoma. Now, you might know of melanoma of the skin. This is a different disease. However, appearance-wise, it does appear to have sort of these melanocytes that are kind of not normal. So it's a rare diagnosis, but it's actually the most common eye cancer in adults. Early symptoms often go unnoticed, but advanced disease can lead to permanent blindness or even metastasis. So it's very important that your ophthalmologist or retina specialist screens you for this just to make sure that you don't have it, but if you do, that it is treated properly. So those are kind of, that's kind of a summary of sort of normal aging changes and more common eye diseases with aging. Let's talk a little bit about sort of more practical advice. So, how do you prevent some of these really devastating problems from happening in your eye? Well, to begin with, it's important to control your blood pressure to make sure that it is not elevated, to control the blood sugar, make sure that's well controlled, and to avoid injury. So injuries that can occur, traumatic injuries that occur with the eye. So some measures that you can take include wearing protective eyewear, especially when you're doing anything that might have the chance of having a projectile or something hit the eye. Having slip-proof rugs and shower mats, avoiding small rugs, securing stair railings, and cushion the sharp corners that you might have in your house, and increase lighting. A lot of the problems that we see are from patients who don't have enough lighting in the house, and they bump into things or they fall because they just can't see exactly where they're going. Of course, regular exercise and a good diet are always important for both your eyes and the rest of your body. And then wearing sunglasses outside, especially at a place like Southern California. So let's talk a little bit about screening. Now, it's generally recommended that a complete eye exam with an ophthalmologist is obtained every year or two after the age of 65. And the ophthalmologist will check for various eye diseases, such as this list here that we already talked about. Now, the last piece I wanted to talk about are emergencies. So, some of the disease entities that I discussed are quite frightening, and it's important to recognize that when things aren't normal and when you can kind of brush off other symptoms. So the symptoms that you cannot avoid and you should seek help include new flashing lights or floaters. So it's not normal to have any new flashing lights or a whole bunch of new floaters. If you've had a floater for 5 years, 10 years, typically that's not a big issue. However, you should still get your normal screening. But if you notice anything new, you should seek medical ophthalmologist's examination immediately. Sudden vision loss, of course, should prompt you to go seek help. Sudden severe onset of pain. So, patients have varying levels of pain and pain thresholds. However, if there's sudden severe onset, that by itself is not normal and you should seek help. Jaw pain or scalp tenderness that's associated with any visual changes. So if you have anything like that, this could be a true eye emergency, and you should have that looked at. Any sudden double vision with the droopy eyelid can be an indication of a very important emergency of the eyes, and so should be evaluated. And then, of course, any trauma to the eye. Here are some more resources from the National Eye Institute and the American Academy of Ophthalmology. And so, feel free to go back to the video to look at some of the resources that these two organizations can provide. Here are some of the references for this presentation. And then I want to thank you for your attention. I really appreciate it. Everyone's time is quite valuable these days, and I really appreciate you joining me this afternoon. So as I said, I'm Dr. Wayne Gui. I'm a retina specialist and surgeon and also a board-certified ophthalmologist. Feel free to visit the website to learn more about me and the practice. I have my email address on there if you have additional questions. Feel free to shoot me an email. There's a phone number for our clinic, and then we have 2 sites, one in Huntington Beach and one in Laguna Hills. And I'd be very happy to evaluate any retinal issues that you might have. Now, I understand that we have some questions, and I'm very happy to answer your questions. Thank you for being patient. If you had a question from the first slide, thank you for waiting all the way till now. So let's look at the questions that we have today. So number 1. Yeah, so can you briefly discuss the new Vuity eye drops? And so this is the eye drop that, if you remember, this is the eye drop that can be used to help treat presbyopia or farsightedness. Now, what this eye drop does essentially is to constrict the pupil a little bit to allow patients who have sort of mild or moderate presbyopia to be able to read without reading glasses. It's quite new, and the results from the clinical trials have been quite impressive, but it isn't necessarily for everyone. So it's a one-day use, one time, one drop per day indication. And if you are happy with your reading glasses and it's not causing you any problems, just stick with the reading glasses is fine, because it is still an eye drop that you have to apply, and of course with any medication there are side effects. One of the main side effects is that because your pupil is going to be constricted, in low light situations, you won't have as good peripheral vision or vision sort of in that low light situation. If you really can't, stand your reading glasses and you don't want any other measures, then it's something certainly to try. I am not an expert in using these eye drops. The ophthalmologists who typically prescribe these eye drops are usually general ophthalmologists or cornea specialists or glaucoma specialists. Ophthalmologists who deal more with the front part of the eye, I am more focused on the back part. So, by no means am I an expert, but in terms of my general impressions, that's what I think. All right, so next question. Ocular migraines, is it more common in an aging eye, and it's something to be concerned about? And then treatment. So ocular migraines is a very curious thing. So, you probably know what a migraine is. And so a migraine often is, a headache of the eye, usually often one-sided, that might be preceded by an aura, either a visual sort of flashing or kind of light, certain patterns of light that you see, or auditory, something that you hear before the onset of the headache. So an ocular migraine is similar in the sense that there are sort of these visual phenomenon, but often are not associated with any headaches. I'm not exactly sure if it is necessarily more common in the aging eye, but certainly, in thinking back to patients who have had this, I can recall that more of the patients are of, the older age group. So, that's something that, I'm not sure if anyone has necessarily studied that, but it's something to consider. Now, is it something to be concerned about? So it is actually, in my clinic, it is not too infrequent to have patients with ocular migraines. If it is occasional, I wouldn't necessarily be concerned about it. However, if it is quite frequent, meaning, happening several times a month or even more frequently, I think it would be a good idea to go to your regular doctor and see if they want to work it up, or even, have you sort of evaluated for any headache, like a headache workup, because very rarely it can be associated with, something that's in the brain. But in general, if it's occasional, maybe it happens once a year, I'm not very alarmed by an ocular migraine. All right, next question. When should we see an optometrist, and when should we see an ophthalmologist? That's a great question. And let me just talk a little bit about the differences between ophthalmology and optometry. So both have very vital roles in taking care of your eyes. So an optometrist typically, go to optometry school for 4 years, and their kind of main sort of goals are to both have you seen as well as you can using any refractive techniques such as glasses or contacts. and sort of being a gateway in terms of determining sort of your general health of the eye. And that often is who, patients in the community or people in the community go to have their eyes checked. Optometrists, they do not do any procedures in the sense of no injections, no lasers, and no surgeries. So there's no surgical training. And typically, their role in the community is more of sort of if there's mild eye disease or there are, kind of things that need to be screened for, they're a very good resource. And of course, for glasses and contacts, they're the way to go. However, if you are having any concerning symptoms or vision loss or anything like that, I would highly recommend an ophthalmologist, because every ophthalmologist goes to medical school, then has an ophthalmology residency, which does consist of surgery, and there's extensive study of all types of diseases of the eyes. Now, a typical ophthalmologist goes to 4 years of medical school and then 4 years of ophthalmology residency, including internship, and then they can start practice. For me, as a retina specialist, not only was the training 4 years of ophthalmology residency, but an additional 2 years focused on the retina, both medical and surgical treatment. And so I would say that in terms of general screening and needing glasses or contact lenses, optometrist would be a good route. But anything that's a little bit more, moderate to severe, or requires more extensive testing and, diagnosis and treatment, I would go with an ophthalmologist, and certainly for any retinal issues, a retina specialist. So I hope that helps. Next question. What is the best time of day to put eye drops for dry eyes? Once upon waking or once at bedtime? Yeah, so I think, this type of thing, when is the best time to put in eye drops for dry eyes? It really varies, and it depends on a multitude of factors. So one is, kind of how your body responds to the eye drops. What I find, I'm not a dry eye expert because I focus more on the back part of the eye, but even in the patients who have dry eyes, they often don't take the drops as much as they can. The eye drops that we typically recommend that you can get over the counter, you can use them quite frequently. So even as frequently as every half an hour, every 2 hours, that's not a problem. Oftentimes I hear patients just take it once in the morning or once at bedtime, and often that's not enough. Because you want to keep your eyes well lubricated, and especially over the winter, or even over here in Southern California, when it's windy, when it's very sunny, when it's dry, it can kind of exacerbate the problem. So you can use it as much as frequently, and there isn't necessarily a best time. I will say though that if the eyes are very dry, it's not a bad idea to consider putting an ointment of artificial tears in at night, right before you sleep, to kind of keep your eyes nice and moist. So I hope that helps for that question. All right, what's the next question? I find using the computer causes my eyes to get tired and sore sometimes. What do you recommend with this? Yeah, so that's a very common experience that patients have. And so oftentimes, what happens, there's a couple of reasons why your eyes might be sore. One is they might start getting dry. When we look at something, when we're looking at the computer, when we're reading, we don't blink nearly as much as we typically do. And it's many times less in terms of how much we blink. And so what happens then is our eyes can get a little bit dry, they can get a little bit irritated, they can tear a little bit more, and so that can contribute to the eye strain. The other thing that happens when we use the computer or read is that we sort of constrict our pupils so that we can read, and that activity in itself requires input of the nerve and the muscle to kind of allow you to read, to constrict the pupils and to have your eyes kind of converge a little bit. That can also lead to the eye strain, and so what I recommend is really taking breaks. So every 20 minutes that you do use the computer or you read, take a nice 20-second, 1-minute break, and this will help kind of allow your body to re-equilibrate and hopefully become a little bit more comfortable. All right, a couple more questions here. What are the symptoms of macular degeneration? So yeah, that's a very good question. So typically, the symptoms include blurriness, sort of the central vision, blind spot of certain parts of the of your visual field of what you're reading, and some distortions of lines. Those are typical symptoms if you have symptoms. However, if you are of an older age and you haven't been screened for macular degeneration, you could have no symptoms at all but still have macular degeneration. So there are two main forms of macular degeneration, the dry and the wet form. And typically if you have early or even intermediate dry macular degeneration, you might not have any symptoms. But it's important to be evaluated and to be observed because you could eventually develop symptoms. And the symptoms are typically, blurriness, distortions, and blind spots. So another reason why it's important to have regular follow-up with your ophthalmologist. All right, another few questions. I occasionally feel pressure in my eyes when I apply eye drops. Should I seek medical attention? So, this format makes it difficult for me to, give specific advice because, not only do I not know your medical history and I can't do an exam, so I can't offer specific medical advice. However, in general, if you have any concern about, pressure in the eyes or vision, you should, seek attention because, even if you don't have anything serious, just for peace of mind, it's important. And obviously, if there is something that's causing these symptoms, it's better to get it treated earlier than later. All right, a couple more questions. When do punctal plugs get used? Yeah, that's a good question. And again, my caveat is I don't typically treat patients with punctal plugs anymore because I'm a retina specialist. But a general ophthalmologist or cornea specialist would be very adept at giving punctal plugs. But based on what I know from my training and for ophthalmology, punctal plugs usually are used after if eye drops or ointments aren't really working for dry eyes. So what happens is, because whatever reason it is that's causing the eyes to be dry, the lubrication provided by artificial tears or the ointment isn't sufficient to kind of control the symptoms. And so the punctal plugs basically are placed to block the drainage system of the tears in one or both eyes to allow the natural tears to kind of stay around longer, to allow for a decrease of dry eye symptoms. So that's typically when they're used, but every doctor has their own preferences and every patient is unique in their own way. So I can't give a specific answer, but in general, that's when they're used. All right, and it looks like this is the last question for today, so I'm sure it's going to be a good one. What does that say? Why would jaw pain specifically, along with vision changes, be associated with an eye emergency? All right, so that's a very good question, and I applaud your curiosity. So whenever, and medical students often learn about this pretty early in our careers. Whenever there is mention of jaw pain or scalp tenderness or something like that associated with vision changes, it behooves the physician to rule out a condition called giant cell arteritis or temporal arteritis. What that is it's a vasculitis, it's an inflammation of the blood vessels that causes disruption of blood flow to certain parts of the eye, and not only the eye, but also other parts of the body. And what happens typically is if you truly have this temporal arteritis or giant cell arteritis, your vision in that affected eye is typically compromised. But not only that, within hours to days, you could lose vision in the other eye unless it's treated. And so the main point of diagnosing this is typically if you have these types of symptoms, it might be a little bit late for treatment for the affected eye, but you really need to be treated to prevent this from happening in the other eye. So this is a very, very serious eye emergency. And if you have anything like this, you definitely need to seek medical help. So I hope I didn't scare anyone out there, but this is it's important to talk about these emergencies because it's not really well known in the general community. And so that's kind of one of the goals today, is to at least give some basic information about what's normal, what's not, and when should you seek medical help. So I hope that helps, and thank you again for your attention, and please feel free to email me at the email address down below, and I hope to see you next time. Take care. Bye-bye.